Medicine and technology come together. Well, some good things can happen. Joining us now from Seton Hospital to talk about that and a whole lot more is Dr. Olusanya. Joining us. Welcome. How are you today?
I'm good. Thank you very much. I'm great.
Good.
It's a beautiful day.
It is a beautiful day, and we're glad to have you on the show. Let's talk about this wonderful relationship between technology and medicine, because it really brings the two together to make it easier than ever for a patient to communicate with their doctor.
Absolutely. Absolutely. So just to kind of give a general overview, when people use the term telemedicine or telehealth, it essentially means, getting the care that you would get at your physician office, but through a video or audio platform.
How have you found that this still keeps that personal relationship with their doctor? Because, I mean, it's the phone, but you still feel like you're connected. Let's talk about ways that you guys make the patient feel comfortable in this process.
So most of the platforms will include a form of video, which is good. Just like you're seeing me now, almost like you're in my office with me, I would be speaking to the patients actually in this room right here. And you sort of get that personal experience because you are seeing me directly, you see my expressions, and I can kind of read the patient's expressions and see how they're doing too. And so you get that sense of being right here in the clinic with me. It's just through this video screen. So that's one way.
Now, I would imagine even during the shutdown and the social distancing, this technology in this way has really made it easy for everyone to feel comfortable, at least, right?
Absolutely. So initially, when we had our clinics closed to patients because of COVID-19 and issues with exposure to outbreaks, patients were definitely very concerned about being able to still have access. And so with the shutdown, this was one way of still getting the same kind of care just through a video platform, like you would do if you called your family on FaceTime or Google Duo, or call them on the phone. It's just that you get to physically see me. And I think that it's really been helpful during coronavirus because patients still have other disorders going on. They still have, I'm an internal medicine physician, so I treat hypertension, diabetes, various other medical conditions. And during the shutdown, those diseases don't shut down. So this was one way that we use, and I personally use it a lot, to still give care to patients, make sure their chronic conditions were addressed and treated so that things did not go south while they were being sheltered at home. In addition, we sometimes will have an acute issue. You have a cough, you have a headache, other symptoms where you need to see the physician. You can't go to Google MD, WebMD, treat it yourself. And especially if you already have a relationship with me and I know you as a patient, I was really able to use telemedicine to take care of these patients without losing a lot of the medical decision-making process, without losing care overall for them.
Okay, we got about 30 seconds left, Doctor. What's the best way for someone to get a hold of this technology and get connected with you?
Okay, so if you want to set an appointment using a platform, please call my clinic, Wellstone Health Partners, at 254-618-1020 to schedule an appointment, and they will give you a specific time. They'll give you an invite through your email or your telephone to go ahead and add yourself to that visit. And if you have any questions, there'll be somebody on that phone to actually guide you through. Thank
you so much. We appreciate your time today.
Thank you.
Thank you
so much. It was a pleasure.
Thank you. It's